This study was about self-harm in older adults. And when we talk about self-harm, what we're really referring to is self-poisoning, often with medication, self-cutting, or other forms of self-injury. In this study, the majority of episodes, about 80%, were self-poisoning. We often think of self-harm as an issue, as a problem in younger people, and this study is a reminder that it's an issue in older adults too. And the really important thing is a particular risk factor for suicide in this age group. So self-harm is a risk factor for suicide across the age range, but in this study we found that older adults who self-harmed were about 145 times at greater risk of suicide than older people who hadn't self-harmed. Suicide prevention's a big priority at the moment, big health service priority, big public health priority. We've just had a Minister for Suicide Prevention appointed in the UK. And the study really shows how clinicians, service providers, policymakers should see self-harm as an opportunity to intervene. What should we do? We should make sure that older adults who have hurt themselves are properly assessed. We should make sure that psychiatric illness and psychological factors are taken care of and managed and treated. We should be thinking about risk factors for suicide in older adults, so treating physical illness, thinking about bereavement as a risk factor, and social isolation. And the other thing I think this study highlights in view of the medications prescribed after people had self-harmed is the need for careful prescribing and medication review.
We use a clinical practice research data link looking at self-harm in older adults from a primary care perspective. We found that there was a high mortality risk, and certainly during the first year following self-harm, those people that harm themselves were 20 times more at risk of unnatural death, and there was high risk of suicide also over the period of 13 years. When we looked at clinical management during the 12 months following self-harm, we found that there were low rates of referral to mental health services and high rates of prescription, with those patients being prescribed a tricyclic, about 1 in 12, which can be toxic in overdose.